question. So the question states, the following findings is seen on blood agar on culture. Which of the following findings will not help in visualizing the C antigen in this bacteria? So C antigen is the carbohydrate antigen, and what we see here is hemolysis. And we have seen that it is complete hemolysis. So hemolysis of maybe of three type: complete and partial, or partial and no hemolysis. So complete hemolysis is also known as beta, partial is known as alpha, and gamma or no hemolysis, that is like denoted by gamma. So this is based on the carbohydrate or the C antigen present in the cell wall of the streptococci. So this gives us the classification. So this is the broad heading of the classification of streptococci on basis of oxygen requirement. We divide it into aerobic and facultative anaerobes, which on hemolysis may be of alpha hemolysis, beta hemolysis, and like I said, beta or complete hemolysis and gamma hemolytic. So gamma hemolysis is mostly shown by Enterococcus group, and beta hemolysis or beta hemolytic streptococci, they are further classified by Lansfield on the basis of C carbohydrate antigen into 20 serogroups, which is A to V except I and J. Then again we have the Griffith typing, which is genotyping based on Griffith typing, which is based on M protein, typing which is based on M protein, and genotyping based on EMM gene into more than 150 M serotypes and more than 200 M genotypes. So coming back to the question, we know that C carbohydrate antigen is present in the cell wall of the bacteria. So they are like, how they are visualized? They can be visualized with the help of, one is plasmolysis, then we have microdissection, then we have differential staining. So these are all techniques by which you can visualize the C carbohydrate antigen present in the cell wall. And then we have electron microscopy. But light microscopy and with simple staining we cannot visualize the C carbohydrate antigen. So the answer here will be simple staining. So this is the wrong answer here. We move on. So the second question we have is swelling of the capsule is not observed in. There are four options: Bacillus anthracis, we have Klebsiella pneumoniae as the second option, Neisseria gonorrhoeae, and Haemophilus influenzae. So what are we seeing in this image? So this reaction is known as the Quellung reaction. Quellung reaction shows the swelling of the capsule of the bacteria, when we add capsular on addition of capsular antiserum. So this becomes swollen and refractile. So the organisms, let us look which produces capsule. We have like all the bacteria, they produce normally polysaccharide capsule except Bacillus anthracis, which produces polypeptide or glutamate capsule, and hyaluronic acid capsule is there in Streptococcus pyogenes. Some strains of Streptococcus pyogenes, they produce hyaluronic capsule. So what are the organisms that has polysaccharide capsule? We have pneumococcus, we have meningococcus, Neisseria meningitidis, we have Haemophilus influenzae, which is again capsulated, Klebsiella pneumoniae, Pseudomonas aeruginosa, bacteroids, and Bacillus anthracis. So now this is the like we move back to the options. So we have seen that Bacillus anthracis, they had polypeptide or glutamate capsule. Klebsiella pneumoniae had